The death toll from coronavirus around the world has now surpassed 200,000. According to figures from Johns Hopkins University, 5 countries have over 20,000 of those deaths: Italy, Spain, France, the UK and the United States.
There are 2.8 million confirmed cases around the world, while 810,000 people are known to have recovered from the virus.
Well, the UK has passed a grim milestone, recording 20,000 coronavirus deaths. It comes amid new warnings from the World Health Organization that patients who've recovered from COVID-19 could be reinfected.
Well, let's get more now from our reporter Nick Dole, who joins us from London. Now, Nick, let's start with this current death toll at 20,000. Is this the UK at its peak with this illness?
Well, we heard a few months ago from senior scientific advisors that they were hoping to keep the death toll under 20,000. They said if they could keep the death toll under 20,000, that would be a good result. Well, now we're seeing just how bad this situation has got here in the UK. We've passed 20,000 and in the last 24 hours, more than 800 further people confirmed to have died in hospitals from COVID-19. Nearly 5,000 more people infected as well in just 24 hours. And that doesn't include the situation in care homes. And we know that many thousands more have died in care homes. They just haven't been reflected yet in the statistics. The NHS is obviously working overtime. It has really struggled when it comes to getting personal protective equipment to people on the front line. But it has done well in other ways in terms of scaling up its capacity. It's built these huge field hospitals across the country. So there are spare beds, there are spare ventilators, but people are still dying in huge numbers. And sadly, some of them, of course, are those hospital workers, doctors, nursing staff and other employees who are on the front line. The Home Secretary in the UK, Priti Patel, spoke a little earlier about this huge death toll.
As the deaths caused by this terrible virus pass another tragic and terrible milestone, the entire nation is grieving. The action we are collectively taking is working, and your sacrifices are undoubtedly saving lives. We know that people are frustrated, but we are not out of danger yet. It is imperative that people continue to follow the rules designed to protect their families, their friends and their loved ones. This will continue to save lives.
As we understand it, Nick, the World Health Organization has also warned that there's no guarantee that someone who may have recovered from the virus would have developed immunity.
That's right. This has been a question that scientists and governments around the world have been grappling with, whether people who've recovered have some sort of immunity, some sort of a defence, and how long that defence might last. Now, the jury is still out on some of those issues, but the World Health Organization says that from the results that it has seen so far, there is no evidence to suggest that the antibodies that patients who've recovered from COVID-19 produce, there's no evidence to suggest those antibodies actually guarantee against infection. And the World Health Organization has warned governments around the world that they shouldn't go down the line of doing anything like issuing things like immunity passports, whereby people who've recovered could simply get on with their lives and live in the community. Given that potentially they could be reinfected, the World Health Organization says that could just make the matter much worse.
But it's not all grim news, though. There is some hope coming out of Europe?
A little bit of hope. Of course, it's all relative, but in Italy there is some good news. The death toll, while still incredibly high in Italy, is down from its peaks. It was 415 on Saturday, which is the lowest it's been in well over a month, and new infections are dropping as well. So it does appear that those very strict lockdowns are having an effect. Also in Spain, the government there has announced plans to scale down or at least partially lift what is a very, very strict lockdown indeed. Spaniards aren't even allowed to go outside to exercise, but the government's just announced that they will be allowed out at least to exercise and get a bit of fresh air from next month if the country continues its progress in flattening that curve, just under 23,000 people have died in Spain from the coronavirus, but the figures do suggest the death toll and the new infections are trending down. So a little bit of good news there too.
Nick, great talking to you. Nick Dole there reporting for us from London.
As the death toll surpasses 52,000 in America, some Republican-held states are moving ahead with reopening parts of the economy. While deaths in New York rose slightly overnight, the state's governor says the number of new cases appears to be dropping. For more on this, our North America correspondent Catherine Diss joins us. Catherine, good morning to you. Just take us through the latest numbers in the US and also with some states moving ahead with those the easing of those lockdowns. Was that a bit premature?
Good morning, Joe. Yes, look, we've passed that grim milestone of 50,000 deaths here yesterday. And over the past 24 hours, 3,000 people have died here. That is one of the highest daily death tolls yet. So while we are seeing the infection rate slow down, we aren't yet seeing the number of deaths slow down. And that's really because of that lag time between someone getting infected to someone becoming very unwell and requiring hospital treatment. Now, the cases here are nearing on 1 million. But despite that, only 1.5% of the population has so far been tested. So it is really difficult to know just how virulent the virus is within communities here. Now, amid all of that, as you've mentioned, a number of states have pushed ahead with reopening parts of their economies. South Carolina, Georgia, Oklahoma and Alaska, all Republican-held states have decided to push ahead and allow some non-essential services to reopen. Georgia, perhaps the most controversially, it has allowed hairdressers, barbershops and massage therapists to go back to work. And as you and I both know, you most certainly can't undertake those professions 6 feet apart. But despite that, they have decided to push ahead and allow some of those businesses to reopen, given the significant amount of economic damage that the shutdown has had on their states.
Catherine, what's the situation like in New York at the moment?
Look, the situation in New York is improving, albeit they did record a slightly higher death toll yesterday than they did the day before. 437 people died there yesterday. That's slightly higher than the day before, but it is certainly much lower than that daily death toll rate that we were seeing just a week ago. In terms of the number of people presenting to hospital with COVID-19, that topped out yesterday at a little over 1,000, and that's where the state was really sitting about 3 weeks ago when the virus outbreak there was far less severe. So that is good news. We heard from the state's governor, Andrew Cuomo, a little earlier, where he spoke about it being day 59 of the coronavirus pandemic here in the United States. He urged people who were perhaps getting a little tired of the lockdown to remain patient and vigilant, given the positive steps that they were making. Let's take a listen to what he had to say.
We are back where we were 21 days ago. 21 days of hell, but we're back to where we were. What we need to find out is when we will be back to the point where only several hundred people showed up at the hospitals every day with a COVID infection. That's what we want to see. We want to know how fast that decline continues and how low the decline gets. And we would like to get back to the days of only 400, 500 people showing new infections every day.
And Catherine, just briefly, are we expecting to hear from the President later on?
Yeah, Joe, we're not sure at this stage. We haven't yet seen him tweet whether he will be appearing or not, but there has certainly been rumours swirling around here over the last few hours that his top advisors are perhaps urging him not to continue giving daily coronavirus updates. Now, that comes off the back of some comments he made a couple of days ago where he suggested his task force investigate whether injecting disinfectant into the patients of coronavirus patients could be an effective form of treatment. That, of course, is not good advice. That sent health authorities here into a tailspin, issuing advice against people not to ingest household disinfectants, and it also attracted a barrage of negative commentary from health officials around the globe. Yesterday, the President did an about-face on this. He said his comments were simply sarcastic and aimed at the fake news media, but it will be really interesting to see whether or not that little episode, which of course was no doubt embarrassing for the President, does lead to any sort of change in his daily press briefings.
Indeed. Catherine Diss there from Washington. Thank you.
81 people have died from coronavirus in Australia, and around 6,700 people have been diagnosed since the outbreak began. 2 deaths were recorded yesterday, one in Tasmania and the other at the Anglicare Newmarch House aged care facility in Western Sydney. While the daily increase of infections remains low across the country, concerns are being raised about viral hotspots. In the Blue Mountains, an employee from the Catholic Healthcare Boddington Aged Care Facility in Wentworth Falls was diagnosed yesterday. Meanwhile, there are now 15 confirmed cases at the Melbourne Psychiatric Hospital. Albert Road Clinic following the diagnosis of another patient yesterday.
Public Health in Tasmania says it's within its rights to maintain strong visitor restrictions in aged care facilities despite warnings from the Prime Minister to relax them. Last week, Scott Morrison warned of Commonwealth intervention and possible fines for facilities that do not adhere to the national coronavirus advice. But the state's acting Public Health Director wants Tasmania to keep observing heightened restrictions.
Health authorities in New South Wales are urging more people to be swabbed for coronavirus as the state's testing blitz continues. Testing rates fell to 4,840 yesterday compared to over 7,300 on Friday. New South Wales Health is calling on anyone with symptoms to get tested.
A New South Wales health report cited by the Commonwealth as evidence that schools are safe to be reopened will be released today. The report tracked all cases of COVID-19 in New South Wales schools from early March until April 21st. It's found there were 18 infections, but only 2 were cases where a student caught the virus from another student or a teacher.